So I graduated from Cornell and then I started EY, but it was in I was still in the US. It was based out of I was based out of the New York office at the time. And so it was a role in kind of the management consulting model. But I was working on a project which was kind of far more data heavy. It was working with a healthcare client and we were working with a lot of healthcare data. So it was my first exposure to the consulting world. And what I really liked was kind of coming from that econ background to have that theoretical fundamental understanding about how these different it was a business kind of, I mean, it's moving from doing a lot of coursework and say macro to like focusing more on business growth and strategy. But what I found key was how relevant statistics and data analytics were. And it was a 1 year experience, but I realized kind of that the econ major had prepped you for thinking about some of these problems, but not necessarily provided you with and this depends on each school and what courses you take, of course. But the core econ major at Cornell, I don't think set you up to really do rigorous analytical work. So my first aim was then to say, fine, I wanted to develop my um, technical skill set in an area which I liked. So and I enjoyed statistics. It's the main technical kind of work you do as an econ major, and one of the more rigorous forms of the analytical work in econ. So I wanted to do that, but I wanted to be able to do it in a relevant field and somewhere where I had access to great data, and that's why healthcare came in. Um,
Yeah.
and the program I found was Health Informatics. Health Informatics is a very also pretty broad term that covers different aspects. It covers how healthcare organizations work in terms of their technology. So, general technological applications in like biomedical devices, in bioengineering. It could also be like more cellular biology related. So it could be like bioinformatics, which gets a little more sciencey. And then it also focuses. My interest was the data science side. So that was kind of, even though I did my program in health informatics, my specific thesis was around learning biostatistics and data science applications in healthcare. Uh, so that
Super.
and it, yeah,
So how
exactly.
does the coursework move? It seems that you could sample many different areas of
Yeah.
informatics and related to healthcare. Uh, so based on the choices you made, uh, what do you think was useful in that 1 year?
Yeah, I think for me it was very useful and it was very important for me to use that 1 year to learn as much as I could in terms of the actual statistical methods and the data, working with data, being able to like, well, because we had access to the Cornell Med School is where the program is part of the Graduate School of Medical Sciences, which is basically where the Cornell Med School is also, which is also part of the med school. So that's affiliated with New York Presbyterian Hospital, which collects its own data through its actual patients. So you get access to the entire database of healthcare data through that. So it's a very rich data source. So for me, um, it was very important to be able to learn the methods to use that really well because it's the kind of data you don't often have access to. So for me, the focus was to get my fundamentals in terms of biostatistics, in terms of data mining, and a bit of machine learning, predictive modeling kind of stuff. Not to the extent where I felt like I was going to go into a career in like heavy lifting machine learning kind of work because I come from a social sciences background, but enough that if you give me data, I can meaningfully get something out of it and present it.
Fascinating. I think using the knowledge that you gained and then the work that you're doing currently, tell us a little bit about how you're applying what you learned in, say, the pharmaceutical industry or the clients that you have in other sort of health tech
Yeah,
fields.
yeah, it's actually very interesting, it's a world I didn't really know before I started working at Analysis Group. So Analysis Group is an economic consulting firm. They work a lot in litigation disputes when you hire an economic expert to testify on subject matters related to uh, any subject around economics, so intellectual property, market competition, insurance, and things like that. But a big part of that is our healthcare client base, which is life sciences and pharmaceutical companies. So it's specifically the area of work is called health economics and outcomes research. But essentially, really, what it is that first at the first stage, drugs need to get approved by regulatory bodies. In the US, it's the FDA. In the UK, it's the National Health, it's the NHS. And the second stage is called market access, which is once a drug is approved, you have to get insurance companies to pay for it and put those drugs on their formulary, which is basically their list of products they're willing to sponsor and get paid for and pay for. Because hospitals and doctors will prescribe a drug, but insurance is very big in America and in Europe. Unless you um, get someone to pay for it, from an insurance perspective, it's never going to be on the market. So, and customers are not expected to pay uh, any of that. I mean, a small portion, but it's such a huge cost that it's not reasonable. So that market access piece is really big. So the goal there is to be able to provide enough scientific evidence from an economic standpoint to say that these drugs are actually working and they're also cost effective. So that's kind of the overall goal where we work to to create value stories for healthcare products to show that economically they're viable and also effectiveness wise they're viable. It's just another application of biostats. It's an application of econometrics. So a lot of the fundamental stuff you change the product, you change it to a healthcare product, and it has some very cool applications.
Wonderful. Yeah, I think it seems pretty relevant in today's age. So I'm sure you're privy to a lot more information on what pharmaceutical companies are doing during times of
Yeah,
COVID.
sure.
Yeah, so let's maybe switch gears and get to know your perspective of
Yeah,
the
yeah,
virus, the vaccine, what's going on in the healthcare space.
yeah. I think
What does data tell us?
yeah, I think I mean what's very clear is this is like the problem here is primarily a public health problem, and that's the crisis which we are facing, which is I think humanity has not been able to uh, it's made a lot of mistakes. People have made a lot of mistakes. Societies have in terms of understanding the impact they have um, on on nature and the natural life and how that will hit back in some ways. So I think overall it's a public health crisis where you number one, we don't have systems in place to effectively really deal with the situation as we're all seeing. Um, from a life sciences perspective, I think it is a novel virus, so I think it's very hard to come at it from a life sciences perspective and you know think about how we are not prepared from that standpoint because viruses are viruses. They can come from they can um, be completely new and you don't know you've not faced that before. So I think the big challenge has been, and the reason why unfortunately so many people have suffered is because there are no systems in place to handle it. Um, and healthcare itself is so expensive in so many parts of the world. I think that's another key problem where, and that's why you see it disproportionately affecting, people from certain low income families, unfortunately, certain racial groups. And that's more of an access thing. That's more of a public health thing where systems are not developed, as you can see, to be equal. So I think the life sciences role is to develop and like discover. Um, which it is doing, and which I mean, I seriously hope there's like enough attention being paid. Then I think there is, but I think there's a much bigger question to be asked here: is that like, are these healthcare systems built to really like be able to
Fascinating.
withstand?
Yeah.